Hi, my name is Arisa Ortiz, and I'm a board-certified dermatologist and the Director of Laser and Cosmetic Dermatology at UC San Diego. So I'm really excited to be with you today about a study that we did using the ALASTIN Restorative Skin Complex. And we know that this targets both collagen and elastin and improves both physician and patient scoring of facial aesthetics. So for this study, we enrolled 5 patients between the ages of 40 and 60 years old, and the patients were instructed to use the ALASTIN Restorative Skin Complex with Tri-Hex technology and a bland daily moisturizer and gentle cleanser twice a day and a broad-spectrum sunscreen during the day. Patients were not allowed to use any other skincare products, and they weren't allowed to undergo any other laser or cosmetic procedures during the entire treatment period. We took clinical photography using the Canfield Visia imaging system, and we took photos at baseline, 8 weeks, and 12 weeks. And then we performed physician grading using a 10-point scale at baseline, 8 and 12-week follow-ups. And we looked at fine lines, radiance, skin firmness, skin plumpness, skin sagginess, and wrinkles. We also had the patients assess themselves at baseline, 8 and 12 weeks, and we used a cosmetic global assessment, which was a validated and commonly used tool. Patient satisfaction was also graded using a 6-point scale with a score of 1 being the least satisfied and 6 being the most satisfied. What we found was that there was improvement in signs of photoaging across all qualities at 12 weeks using the ALASTIN skincare, and that was including fine lines, radiance, skin firmness, plumpness, sagginess, and wrinkles. And then when we looked at the Patient Global Assessment Survey, at 12 weeks, all patients strongly agreed that using the ALASTIN skincare improved their skin quality in each of the categories assessed by the survey. And this included things like their skin felt softer and smoother, improved overall skin tone, and increased radiance, among others. Here are some before and afters, and this one really impressed me. If you look along her nasolabial fold, you can see that at 12 weeks, it almost looks like she got a little bit of filler because she definitely looks more volumized. And you can even see some subtle improvement in the erythema because we know that this does have some calming effects as well. Here's another patient that really blew me away. She just looks so radiant in the 12-week photo, and you can even see that her pores look a lot smaller, and she just has this really nice radiance to her. And then final photo that we have here, you can see that this patient got some nice improvement in wrinkles, and this is using the Visia imaging system. You can see that there's definitely fewer lines in the 12-week photo, and you can even see that this patient also had some nice improvement in her erythema as well. So how do I use these products? Well, I really like to use the ALASTIN procedure enhancement system with a lot of the resurfacing procedures I do. I use it with non-ablative or ablative fractional resurfacing. I use it with fully ablative procedures, and I really like to use it with the needle RF devices that I have. And I have patients start it a week to 2 weeks before their procedure, and then continue on while they're healing. And it really helps to decrease the downtime for patients by at least 2 days, and it helps them get back to their daily lifestyle much quicker. So do I use the ALASTIN procedure enhancement system differently depending on ablative versus non-ablative treatments, and how? Well, with the ablative procedures, I like to use the calming balm versus with non-ablative, I don't really feel like they need that ointment. It's nice to have it in case they feel dry the first night, then they can use it. But usually I just reserve that for the ablative procedures. I'll also maybe have them use it for the full 2 weeks if they're going to have the ablative procedure versus non-ablative treatments. Then I want to make sure they use the nectar for the full 2 weeks. I'm a little more lenient with the non-ablative treatments. I think a week is probably enough time. And so how do I incorporate the pre-treatment phase of the regimen, regenerating skin nectar for ablative or non-ablative procedures? So as I mentioned, I usually have them start it a week to 2 weeks before. And I usually mention it during the consultation. So when I'm discussing different procedures that different options, then I'll usually mention the regenerating skin nectar, and I'll have them start that right away so that they can use it for a few weeks before they actually have their procedure. And so in terms of feedback that I've received from patients using the ALASTIN procedure enhancement system, even just today, I think patients are surprised at how much they love the nectar. They've never really felt anything like this before. It's difficult for them to kind of describe the texture. They usually describe it as a very silky feel. And patients love it so much they always ask if they can continue to use it even after they've healed from the procedure. And that's something that I personally like to do as well. So I love using the nectar on a daily basis. I just like the way it feels. And so I think that's a definitely global opinion that my patients have, is they just really like the feel of it and they continue to use it. And in terms of integrating the ALASTIN procedure, some practices will bundle the kit into their procedure versus purchasing it separately. At my practice, I personally have them purchase it separately. So I like to keep things separate so that they know, what they're purchasing. And I think that's just a personal preference in terms of how you like to manage your practice. I think either way works depending on the type of practice you have. For my patients, I usually tell them, you'll get a good result with the procedure. If you want an even better result with less downtime, then I recommend purchasing this ALASTIN procedure enhancement system. And so in general, they purchase it separately. And so my experience with the ALASTIN daily skincare products is, I think overall, the one thing that I noticed that is the most impressive is that it really makes your skin radiant. So the restorative complex in particular, I really just see this overall radiance in all the patients that are using it. And also I'm impressed by how well it's able to kind of plump the skin. So I don't really see that with many topical cosmeceuticals. I don't see topicals that are able to achieve the plumpness that the restorative complex is able to achieve, and that's really what's impressed me the most. So, I think the key benefits are what I've mentioned already, just the radiance and the plumping of the skin and kind of that tightening of the skin, which is difficult to achieve for cosmeceuticals, but I think ALASTIN skincare has really achieved those results. And so how do I explain the technology and activity of the products to my patients? I try to keep it simple for them in terms that they can understand. So I usually just say that the products contain trihex technology, which is a type of peptide or an ingredient that stimulates wound healing and also stimulates collagen and elastin production, and that's usually something that they can understand. And then I also say that there's different key ingredients that are anti-inflammatory that can help calm the skin down, and that's how it can decrease the healing time with these procedures. So with patients, I don't think you need to go too much into detail. I just like to use simple terms so that they can understand. And that is it. Thank you very much for joining us.